The battle against HIV/AIDS rages on, and according to recent estimates, adolescent girls and young women aged 15 to 24 record the highest new infections per week compared to all population groups. But treatment is still lacking.
We want a government that listens to the voices of communities, that is responsive, action-oriented, and accountable to communities that they serve, and willing to collaborate with the civil society. We need to work together as stakeholders to ensure that everybody has equitable access to treatment by accelerating our collective effort of retaining more people with HIV on treatment to achieve the global goals.
Some health experts say the funding hemorrhage on HIV/AIDS programs experienced in the country and on the continent this year could impact children and mothers.
We do need to focus on the children and make sure that our antenatal care, our infant diagnosis, and our triage into care is taken care of, particularly in the children of under 15. So this is a concern, and it's important for us to continue to track the amount of children who go on to treatment and are retaining care. So I wanted to also just look at some of the modelling that has been done. So with the kind of PEPFAR cuts that we've seen, what kind of reverberation that we have in this climate where we're trying to end HIV in 2030. So this shutdown, this USAID funding shutdown has estimated that we could see up to 500,000 deaths in South Africa over the next 10 years. And if you look at the various modelling that have been done, you can see that if we maintain our status quo, we can actually see another around almost 600 new infections happening in the next couple of years if we don't have any other additional input.
Government officials say they're working on increasing domestic funding to mitigate these challenges.
I was happy when the Deputy Minister was briefing me earlier, and he said that despite all these challenges, they are doing everything to ensure that we don't regress. We are now concentrating on augmenting our domestic funding, initiating national campaigns, and exploring partnerships with the BRICS nations and the private sector in our country to address the funding deficits.
Mashatile says the South African National AIDS Council has recently developed the HIV Prevention Roadmap 2025 to 2028 with guidance and technical support, which will, among others, identify gaps and take remedial action to scale up precision HIV prevention and to prioritize populations and regions most affected by the HIV epidemic. Mulimo Nemoto, SABC News, Kempton Park.